Healthcare. My best advice, well, don't get sick, at least not here in America. I mean, sure, you're probably going to get healed, but can you afford it? Healthcare is a seriously big concern for our age crowd. You know, the over 50, over 60, don't want to admit it, but we're kind of proud to be it anyway kind of age crowd. Now, here's the deal, and this is my opinion only, but I think it's kind of a good one. Now, think about it. Our corporate overlords, they have a bazillion ways to make money. They can sell widgets. They can dig for fossil fuel. They can have all kinds of things. But is our collective health, should that actually be one of their commodities? I say, well, no. Think about it. You got for-profit hospitals. You got for-profit big pharma and big medical devices, for-profit health insurance. Where's all the for saving and improving lives side of things? Frankly, I am tired of being somebody's commodity. Now, I truly believe that worldwide, we just don't get it. We are not our own product. We allow ourselves to be sold for profit here in the first world. And elsewhere, they just want some clean water. And for some dumb reason, we all just accept this status quo. Well, let's talk about that status quo. Now, what is nirvana? Well, for me, nirvana is, healthcare for all and not for profit. Now, remember the ACA, also known as Obamacare? Well, it was a semi-decent start, at least before Congress had its little way with it. But there was a basic problem, and we were fighting for health insurance for all, and I'm putting that in air quotes, by the way. We were fighting for health insurance for everyone, which meant that we would all still need to pay for it through our jobs or through a marketplace. And that's problem number one. Why in the hell does our healthcare system what does it have to do with where we work? And by the way, stay tuned for that story in a bit, because it really is kind of a weird, sad story, at least for us non-corporations. But let's stay on point for now. Healthcare, us being a product, how sad that is. Okay. I get it. Someone has to pay for healthcare. Someone has to pay all the providers and for all the equipment. And let me throw in a caveat here really quickly. I don't for one instant want to deny salaries to those involved. I was actually once married to a physician. And I know what kinds of sacrifice they put in just to get the education needed. I know the efforts that they got to pay just to get their student loans. If you think paying off your marketing degree takes a long time, you ought to try a medical degree. Anyway, just kind of wanted to throw that out there. My gripe, my rant, my rave is not against healthcare providers. But, the people that I do have a problem with is that nameless stockholder in his high-rise penthouse. Why does he have to be involved? I get that I got to pay for my share of everyone's health. And I'm cool with that. I'm absolutely fine. But the fact that I've also got to pay for some dude's third Lamborghini, I just find that totally, totally unacceptable. Now, I want to tell you a story of healthcare in another place, but I'm not going to tell you where that other place is. So stick around to the end of the story to find out. Anyway, what was it? Jesus, it was before COVID. I don't know. It was like 2019, I think. My girlfriend and I were traveling, and she hurt her back. Now, she seriously hurt her back. The kind of I can't walk, I can't move, I can't breathe without extreme pain kind of hurt your back. And we were well outside of the United States. But we had to do something. So off to the emergency room we went. Now, we walked in and we gave them our information, and we were actually quickly sent over to this triage nurse who probed a little deeper into her condition. And never once were we asked about finances or insurance. Not once. This was going to be bad, we thought. This is going to be really, really bad. But Nikki needed to see someone, so we had to be there. Now, about 5 minutes later, they had us back in a room in the ER, and it looked like just any large hospital in America. Only there seemed to be a lot more information everywhere. They had signs up, and it was very instructional. Well, we were seen. Nikki was medicated, and she was evaluated. It took maybe 2 hours in the ER, and they were offering up physical therapy services and all kinds of other services, and they gave her a prescription, which I went off to the hospital's pharmacy to get filled, and that was that. She felt better. She knew what was happening, but that wasn't the end of the story. So there we are, standing in our room, and I don't remember the number of it, 411, something like that. But the curtain was drawn, and we didn't know what the hell to do next. We'd never been there before. And so as we're standing there contemplating our karma, we very clearly heard a nurse out there tell an orderly to put the next patient into room number, the room in which we were standing. We're looking at each other like, oh, what's going to happen? Well, the nurse pulled back the curtain, and there they were, and here we were, two confused Americans. And then she looked at us and said, was there something else you needed? And we said, well, where should we go next? And they said, well, home. You need to go home. So, well, where do we pay? And she just stared at us. Now she was as confused as we were. You see, healthcare in the UK, it's free. Period. Okay, not completely free. That prescription I talked about a little earlier, it cost me £9. So I think I had to pony up $12 American just to get Nikki healthier. But they don't pay for healthcare. Nobody, a visitor, doesn't matter who you are. Healthcare is a right. Healthcare is just part of living. So yeah, it's possible to have really high quality healthcare, affordable healthcare, and not have to mortgage a damn house to get it. And that to me is the one big fallacy of the ACA is it still uses words like insurance and taxes. Those words have really unfortunate meaning to some people, the liberty and freedom crowd. Why can't we just say, I don't know, we're all just going to chip in for healthcare, and every penny or pound goes right towards that, and not for somebody's profit, not for somebody's Lamborghini. If a body needs to be fixed, they can get it fixed. It's just our right. And like I say, I'm tired of being a commodity. I actually believe that as human beings, we need to take care of each other, and that means ditching the insurance and just start healing. Okay, let's take a short break because I want to talk to you about the YouTube channel that I've got, this whole weird media enterprise, and a little more about this podcast. So give me 2 minutes and we're going to get back to healthcare. But did you know that I actually have a YouTube channel? And it's also, it's called The Pirate Wanderer. I forgot what I'm calling this podcast. Something about 50, 60-year-old people. Anyway, the YouTube channel is exactly about what we're talking about here, although with video, and you get to see my shining little face that goes along with my baritone voice. Anyway, go to rickhiggins.com if you haven't already, and click around. It'll tell you all about the YouTube channel. It'll tell you all about the books that I've written. Did you know I was an author? Well, I am, and the books are free, by the way. They're out there. And all the social media sites. So free. Lots of free stuff out there. And like I say, take a look around. See what's happening on the YouTube channel. Subscribe. And, let's get back to the healthcare. So I mentioned this earlier. Do you want to know why your health insurance, why it comes from your employer? Well, it involves World War II, some really weird loopholes in 2 laws that Congress passed, and, some different paths that different nations took. Now, this tale actually starts back in the 1920s, probably before a lot of us were born, I think. There wasn't any health insurance back then. There was none. People just paid for care out of their pocket. And, fortunately for them, it wasn't that expensive, at least not compared to today. Now, there were a lot of attempts at improving over the years that followed. There was even a nationalized healthcare and nationalized insurance that was proposed, but the Great Depression pretty much squashed all of those ideas. And around the same time, Blue Cross and Blue Shield had been formed, but our president, FDR, he couldn't really get any traction at the national level as far as healthcare Well, because there was a lot of severe pushback from lobbyists. Hey, does that sound familiar to anybody at all? And then came World War II. Now, because so many people went overseas to fight, there was just this severe labor shortage. Sorry, got a little tongue-tied there. So Congress, they passed a bill called the Stabilization Act of 1942, and they also passed one called the Revenue Act of 1942, which in part froze wages and salaries. And they also seriously raised taxes on corporations. Got to profit, got to fix the war effort, I guess. So, taxes were like up to 90% of profit over pre-war levels in some cases. And there were loopholes, fortunately, at least for the corporations, in those bills. Now, if you're with me so far, so World War II has come. Congress has put a severe squash on companies being able to hire and is also taking a lot of money away from them in taxes. So how do companies get employable candidates? I mean, there's very few remaining anyway. Most of the men are off at war. So if you can't offer more money because the wages are frozen and you gotta have people, well, what do? Well, that loophole I talked to you about, it allowed you to offer other benefits like health insurance. See, insurance isn't limited and it wasn't taxed either for the employer or the employee. Voila, corporations have some way of enticing people to come work for them. Ha ha, hallelujah, the heralds sing. Now, this was really welcomed by both sides, employer and employee alike. I mean, no taxes equals good taxes, right? And overall income, again in air quotes, could be raised. You got a little more than you could have had before. Now, at the same time, they did have individual insurance. You could go buy your insurance, but it really wasn't a thing in those days. I mean, the underwriters back then had absolutely no limitations. So if you had a pre-existing condition, you're going to be denied, or they're going to give you just completely unacceptable rates. Sound kind of familiar pre-ACA? So anyway, people back then just mostly stuck with what their employers offered them. Now, that's kind of why we're stuck this way. That's what we got. That's what stayed, because the one thing America is really good at is we don't like change. But hark back to other countries. Now, during and after World War II, the United Kingdom, of which we spoke of earlier, and Canada, they went in a completely different direction. They established national healthcare, and they basically eliminated insurance altogether. Now, here's an article I was reading back in 2005. Well, that's when it was published. I actually read it recently. The National Institute of Health. It was titled, "Money Cannot Buy You Satisfaction." And in summary, basically they determined that the healthcare system in the UK performed as well or better than the US system, but it cost far less. Well, how much less, you ask? Good question. Did you know that in 2018, the United States spent $3.6 trillion on healthcare? That works out to roughly $11,000 per person. Around the same time, the UK spent 197 billion pounds in total, which comes out to around $4,000 per person in US dollars. Now, let's weigh those together. We spend $11,000 per person. The UK spent $4,000 per person. And for the same healthcare. Let's put that in larger terms. The United States spent 15% of its gross GDP, I can even think, your GDP on healthcare. And the UK spent less than 8%. So the UK spent almost half less of their GDP than the United States for healthcare that, in the very words of the US government, performed as well or better than our system. So anyway, that's how we got here. Why we stay here revolves around big money, lobbyists, politicians who care more about their corporation and campaign bankrolls and you or I. And, we got a few really good examples of where we could have gone, where we could be, but we won't. Healthcare for all. I mean, that's really what we're after. Not just the employed, not just those who can afford it, but healthcare for anyone, for everyone. So I have a question for you. Do you still think we don't need a major overhaul of the healthcare system? I think the ACA was good, but we have to continue way past where it started. All of this nonsense of repeal and replace, that's backwards. We got to go forward. The ACA has some really good things in it that help people in their 50s and their 60s and their 40s and their 30s and their 20s. It's got some really good protections for humans and just maybe not so much for corporations. It's a good start. We just need to continue that. I think we really need to continue towards nationalized healthcare. Now, I know all of you other kind of people who think differently are running their mouths about socialize this and socialize that. That word is just, it's a key to try to get you drooling and fighting and barking, and it's working. Socialized or nationalized healthcare is no different than the national park system. So, when's the last time you went to Yellowstone Park? Probably never, but you're paying for it because, it's your right to have a national park. Well, if you're willing to have a national park, why in the hell aren't you willing to have national health care? Because one day you are going to get sick. You can't guarantee that you're always going to get to Yellowstone. So anyway, that's what I got for you this time. Just some food for thought. If you agree with me, don't agree with me, send me an email, rick@rickhiggins.com. Let me know what you think, and we will talk to you soon.